Hello all. In today's video, we are going to discuss about basic yet very important chapter, symptomatology. Let's see what are the contents of symptomatology. For better understanding of the chapter, I have divided it into three parts. First part is introduction to symptomatology. Here I will discuss in detail about basics of symptomatology with examples. Here I will also discuss about how to record a symptom while taking a case. While second part deals with symptomatology of the mind, in which I will elaborately discuss the classification of mental symptoms using example and its hierarchy. While third part deals with different types of symptoms, in which I will discuss in detail about definitions and key characteristics of different symptoms using examples. Why symptomatology is so important? Every case discussion begins with the symptoms because entire management of the case depends on comprehension of the symptom. If we don't grasp the symptom, we won't be able to take the case properly. And if we fail to take the case, we won't be able to diagnose the case. And if we don't diagnose the case, we won't be able to state its prognosis. Without knowing the prognosis, we could struggle to decide whether to accept or reject the case. Unless we understand the fundamentals of symptomatology, we won't be able to do classification and evaluation of the symptom. And if we fail at this step, we won't be able to understand the susceptibility and miasm and further totality formation, and finally, it will lead to wrong remedy and potency selection, which will affect the entire management of the case. Therefore, Stalwart says, full comprehension of symptomatology is essential for intelligent understanding of the laws of harmony. Now let's see what Stuart says about importance of symptomatology. In his chapter on symptomatology, he says, knowledge of the true nature and constitution of a symptom is necessary in proving or testing medicines, in the examination of the patient, in the study of the materia medica, and in the selection of the indicated remedy. So, from these lines, we can understand knowledge of symptomatology is required at every step involved in the management of the case. Let's begin this chapter by defining the term symptom. This term derives from Greek word symptoma, which means anything that happens. In other words, symptom can be defined as any evidence or change from a normal state of health. Various homeopathic stalwarts have defined symptom differently. However, they share a common meaning. In conclusion, we can state that a symptom is nothing but the external manifestations of internally deranged vital force. For example, if a healthy individual gets wet in the rain and next day suddenly develops a fever, we say that person is sick. In a given example, fever is nothing but the external manifestation of internally deranged vital force. There are three planes at which you get different types of symptom. So first one is mental or emotional plane, second one is spiritual or intellectual, and third one is physical. We will study in detail about symptoms belonging to each plane separately. Symptom has different elements like location, sensation, and modality. Let's study each element in detail. First component of symptom is location. Every organism comprises of cell, tissue, organ, and system. Every disease has a tendency to localize in course of time in some part, tissue, organ, and system. So when we point out location of any disease condition, it should include underlying tissue, organ, system, site, area, extension, then side of the body affected, and the direction taken by further involvement of the disease. Let's take an example of each. When we say site, it is nothing but the specific point. For example, McBurney's point. In cases of acute appendicitis, patient points out pain at this point. If we understand the exact location, it will help you to narrow down your diagnosis. Likewise, there are different areas of body. For example, cardiac area or neck area, thoracic area. Just like site, exact area will help you to narrow down your list of differential diagnosis. When we talk specially about pain, Or major wounds like burn, we have to mention about extension of pain. Or wounds, say for example, in case of sciatica, pain in hip might extend till heel. When we talk about pain, we also have to mention about radiation of pain, which helps us in diagnosing the case better. For example, pain of renal calculi usually radiates towards back, but in cases of ureteric calculi, it will radiate towards urethra. So if we elicit the exact location, it will help us in quick pathological diagnosis, and further it will help in quick acute prescription. Other factors considered in location are side of the body, like left or right, and direction taken by the disease, like upward or downward or sideward, etc. Different remedies have different side affinity. For example, if we talk about lycopodium, you will get complaints on right side, or complaints will start first on right side and then they will go to left side. Boger and Bonninghausen has given a lot of importance to location, and if we talk about value of location, so location stands next to the sensation, modality and concomitant. Next component of symptom is sensation. Sensation is nothing but the abnormal feeling experienced in any particular part of the body or by the patient in general. Let's take an example of abnormal sensations. Burning pain in soul as if fire is kept inside, or band-like sensation around head. If we talk about general sensations, then patient may experience nausea or vertigo in general during complaint. Every clinical entity has its own peculiar sensations. For example, in cluster headache, patient will say he is having excruciating or penetrating type of pain. So it becomes common sensation of that disease entity. If we take example of dysmenorrhea, here patient will say she is having cramp-like pain in lower abdomen. Here cramp-like pain is common sensation of dysmenorrhea. But physician is particularly interested in abnormal sensations which can't be explained on the basis of pathological changes, because those represents individual characteristics and help physician in prescribing the medicine. If the intensity of common sensation is high, then those sensation becomes characteristics. If we take example of dysmenorrhea, as we know cramp like pain is common sensation of dysmenorrhea, but if the intensity of cramp like pain is very high, we can take cramp like pain as a characteristic symptom. If we talk about value of sensations, then sensation stands next to the modalities while formulating the totality. Next component of symptom is modality. Let's understand the meaning of modality. It is nothing but the particular mode in which something is experienced. The main component of modality are circumstances of occurrence, that is cause or ailments from, aggravation, the factors which increases the intensity of the patient complaints, and ameliorations, which are nothing but the factors decreases the intensity of patient complaints. In other words, modalities are nothing but the modifiers of the complaint. Let's learn about cause, that is circumstances of occurrence. There are different types of causes like predisposing, precipitating, and maintaining. Cause bears the highest importance in totality, be it mental or physical. Causative factors in emotional sphere are of highest importance and are followed by physical factors or causes in physical sphere. Different types of causes in mental sphere like grief, fright, shock, death of loved ones, etc. While examples of cause in physical sphere are like drinking cold water, then having outside food, mechanical injuries, etc. Other components of modalities are aggravation and amelioration. Aggravation are the factors which increases patient complaints, while amelioration are factors which decreases patient complaints. There are different types of modalities like thermal modality, positional modality, and time modality. If we talk about thermal modality, it means different temperatures like cold or hot. For example, complaints are aggravated on exposure to cold winds, or complaints are better or ameliorated by drinking hot water. Another type is positional modality, which means different positions. For example, cough is aggravated on lying down, or cough is aggravated on sitting up, or pain in shoulder is ameliorated by lying on affected side. Next type is time modality. For example, time of the day, particular season, or any specific period or phase. For example, fever aggravation during morning, itching of the skin aggravation during night. Joint complaints are aggravated during winter. Complaints specifically during menarche or during menopause or during teenage or complaints during infancy represents the time. If we talk about the hierarchy, then causative factors come first, then aggravations and then amelioration. From the standpoint of the individualization, modality assumes the highest importance. And if we talk about its valuation, then modality stands next to the concomitants. Let's study in detail about intensity of symptom. We can use 3, 2, 1 numerical values to indicate the intensity of symptom. 3 indicates severe, 2 indicates moderate, while 1 indicates mild intensity of the symptom. The susceptibility and sensitivity of an individual plays a major role in production of symptom. While severity is determined by the patient's sensitivity in general, as we know, few are oversensitive while few are stoic. Reaction pattern and severity of reaction to same event varies from person to person. Say for example, almost every individual during teenage experiences heartbreak, but reaction pattern to one event is different in every individual. One person may experience grief, while other person might feel betrayed. Next person might feel abandoned. Even the period or intensity of suffering also varies from person to person. One may take hardly 8 days to overcome the trauma, while another will take 6 to 7 months, maybe a year to overcome the grief. Common symptom may become characteristic if the intensity of symptom is very high. For example, burning pain during micturition is very common symptom of UTI, but if the intensity of symptom is high, it can become a characteristic symptom. So in case of UTI, if the burning is very severe, it becomes characteristic symptom to that particular case. Intensity is very important while evaluating the symptom, because if physician fails to mention the intensity of symptom, it will be very difficult to prescribe the remedy. Let's study very important aspect of symptomatology, that is classification of symptoms. Any symptom is divided either into mental symptom or a physical symptom. Mental symptoms are always general symptoms, which are further categorized into common and characteristic, while another type is physical symptom, which are further categorized into physical general symptoms and physical particular symptoms, which are further categorized into common and characteristic symptom. I have discussed in detail these two different classification in two different videos. Part 2 of symptomatology deals with symptomatology related to mind, while part 3 of symptomatology deals with physical symptoms and different types of symptoms. So far we have learnt about what is symptom, what are its different components and details of each component. Now we will learn about how to write a location, sensation, modality while recording a case. As we have seen in initial part of video, location contains system, organ, tissue, site, extension, radiation of pain, etc. While sensation should include any abnormal feeling, character of pain, character of discharges, etc. And modality should include elements from or cause, then aggravating factors and ameliorating factors. Let's see different formats of recording a symptom. There are two formats of recording a symptom. In first format, you record the symptom as the patient described them to you without splitting it under location, sensation, modality, and concomitant. Instead, you record symptom in a horizontal format in a proper chronological sequence, followed by its onset, duration, and progression. While in second format, symptom is recorded by splitting it into its different components, that is location, sensation, modality, and concomitant. This is a very analytical way of recording a symptom. I have given two examples of first format. Here you can see that entire complaint is recorded in a horizontal format and a proper sequence is maintained. Now let's take an example of a case of UTI. Patient comes to you and states her complaints like she is having burning pain while urination. Let's see how to record it systematically. Under location, you can write system, organ, duration since when. So here I have written its system, that is urinary system. Location is urethra and she is suffering since 2 days. Onset, duration, progression and intensity of pain. So here onset was sudden, duration pain was continuous, while progression is slow. It is still at the local level, and intensity of pain or intensity of complaint is high. Under sensation column, as we have discussed before, we can write any abnormal sensation or character of pain and character of discharges. So in a given case, patient is having severe burning pain while micturition. Her frequency of urination is increased while character of urine is scanty, dark and offensive. Uh, and under negative history, there was no blood in urine and there is no history of fever. You can see under sensation, I have mentioned its intensities. If we talk about modalities, we have to write cause, aggravating and ameliorating factors under this particular column. In a given case, there was no significant cause, but burning pain was aggravating after urination. Here I have given its intensity 3 plus. While this burning pain was getting ameliorated by application of hot water and its intensity was 2 plus. Many students find it difficult to record cases in this format, but with practice you can master it. You can practice by choosing any random clinical condition from clinical textbook and record its symptoms in LSMC format. This will help you in improving your case taking and recording. Same can be applied to remedy. You can choose any remedy. From that, you can choose any system or organ of your choice and classify those symptoms under LSMC. Here, I have taken an example of Naxwamika and I have chosen one particular organ, that is head. Under head, you will get head pain in frontal and occiput and over eyes. Usually, the onset is sudden and intensity of headache is high. Under sensation column, sensation of headache is like pressing type of pain with vertigo and brain feels turning in circle. This is something abnormal sensation of Naxwamika headache. And usually these headaches are aggravated in sunshine, in morning, after alcohol and after mental exertion. So you can do this activity to improve your skills of recording LSMC. Thank you for watching the video. I hope you liked the video. Do watch part 2 of this topic, which will deal with symptomatology related to mind.